Hi, this is Shelley Kraft. We're coming to you live on SNNLive. We're at BioMaryland's booth at Bio International 2014 right here in San Diego. I have with me Dr. George Falus of Biomedica. It's a private company. Welcome to SNNLive.
Thank you for having me.
It's good to have you. Tell us about Biomedica.
It's a small company that it was founded like 8 years ago. It's funded by NIH and the Department of Defense. Well, we focus on blood coagulation products, mainly for the battlefield and also for the surgical room. And we address unmet needs in surgical hemorrhage.
What's your biggest product right now?
It's Clotform is a product that can be used for very severe hemorrhage or when somebody or a soldier has a wound in the abdominal cavity, a severe wound. It can save his life or her life. And it also addresses many other severe bleeding issues on surgery.
And it has to do with blood coagulation and clotting?
Exactly. It's a new way of coagulating blood, and it's very effective and strong.
How is it delivered?
It's delivered through a mixing device. It can be used through any opening in the cavity, or we can do it laparoscopically or in surgery through a mixing device.
And so it's not intravenous?
No. It's topical. It occurs. It's delivered on the wound itself.
Is it a powder or?
It's a foam. It's like a shaving
foam.
Cream. It's like a shaving
cream. Oh, that's really interesting.
Yes, and it adapts very well to the organs and does really extraordinary things because if somebody is wounded in the liver, it would probably die in 10 to 15 minutes, and anyone who receives this treatment survives with no problem.
So you're extending life. In reality, when somebody could bleed out on the battlefield or bleed out in a operating room, and it doesn't really matter what type blood you are in this particular case.
No, what it's called is stabilizing a patient to allow him to or her to go into an operating room in a car accident or in a street or in any kind of trauma situations. And this is the first intragravitary product that's been developed for trauma.
So I could see it on and in every ambulance, in every medic's backpack. I mean, I see it as that kind of a product.
Possible in a few years. We hope that every ambulance we have a device like that would save many lives.
Did you develop this yourself?
With a group of scientists that are really prominent scientists, we did develop them.
Yeah. So why Maryland? Let me ask you that.
Because it's a very generous state. We have received the first funding from the Technology Corporation of Maryland. We have had great support. We have our laboratories at one of their incubators, a wonderful place. We keep expanding and having space. And it's very affordable for us. And we have a very strong support from the senators of the state of Maryland and from the state itself.
What is your website for our audience?
Our website is biomedic.net.
Biomedic.net. BIOMEDIC.net. I got it?
Correct. Yeah.
Ladies and gentlemen, Dr. George Falus from Biomedica. It's a private company. I'm Shelley Kraft. This is SNN Live. We're coming to you from BioMaryland's booth at Bio International 2014 right here in San Diego. Thank you, Dr. Falus, for coming on to SNN Live.
Thank you.
You're welcome.